Now, yesterday, the Secretary of State said the pressures on the NHS are sustainable. But we have ambulances backed up outside hospitals, patients waiting hours upon hours in A&E, cancer operations cancelled and NHS staff exhausted. Has there ever been, in the history of the NHS, a more complacent attitude from a Secretary of State as we head into winter?
Just yesterday, the Italian Prime Minister pointed at this country as an example of what not to do. It's now the case that we are such an embarrassment that it's encouraging people elsewhere to follow the rules.
I'm disappointed in the Honourable Lady's approach because we have led the way, not just in vaccines and sourcing vaccines very early on, but also in antivirals.
We're fortunate enough in the last few weeks to go to both France and Italy. Both countries have got vaccination rates very similar to the UK. In fact, Italy's got a slightly higher rate now. The difference is you can't go on public transport or in a supermarket without wearing a face mask. You can't go in a bar or a restaurant or a leisure centre without having a health passport and showing it. Infection rates in those countries are now around a tenth of what they are in this country. Does the Minister accept that those public health measures they have taken have affected their infection rates and brought it down well below our levels?
We laid before this House our autumn and winter plan, and that provided certain measures, the non-intervention measures that people can make their own decision on, because we believe that people can make informed choices. And I think as people see the levels rising, then they will look at the guidance again and perhaps make decisions perhaps to wear their face coverings in more venues.